is Siu Wan. I'm going to talk about future issues in healthcare. So, healthcare now has been evolving in almost all the fronts, in terms of gene therapy and Da Vinci surgical machines that help go deep down into, the actual human body and surgeries, and more complicated, more complex. As we go along, we actually have cures from HIV from young infants, as it's been discovered, and there's also been, maybe the beginning of human organ production, 3D printing. It's something they're looking into now. And in all those fronts where care has been revolutionized, and also parts of it stagnant, have not actually been improving as far as someone like. And that would be actually the actual interaction between patients and clinicians. And it's been staying about the same as it's been since the great-great-grandfathers of ours. How a patient would actually go to a clinician's office, have a checkup, talk to them, ask them about their lifestyle, gain some of their wisdom from recommendations from the clinician. But as the future goes on, we're actually going to change how healthcare is being done. It's going to be a consumer-driven kind of a healthcare facility and program style, where actually we give the reins to the consumer, where they manage their lifestyle, and they actually just talk to clinicians and nurses for some of their recommendations and their wisdom, maybe through teleconferencing or email, text, and stuff like that. And there's going to be probably less of going to an actual facility and more of patient-managed modernization of healthcare. So as the future of healthcare is evolving, there's multiple stages of healthcare. There's a thing now that the government is actually trying to implement, and it's called meaningful use. And there's also another one started by a lot of healthcare clinicians. It's called Tiger Initiative. What these are for is basically transforming the healthcare field and the landscape of it by subsidizing certain advancements in the healthcare kind of generation that we have now. A lot of things have been done on what we call paper charting, where the staff or clinician would have to just write it on a piece of paper, clarify it, and sign it off. Things now are moving toward what we call computerized charting, or EHR, electronic health records, where we actually document on the computer. It's recorded automatically, and it helps kind of make things more efficient in terms of billing, coding, cost management, resource management, putting in orders for doctors, putting in documentation for nurses. It just makes it easier, and you can actually save it onto a server or just a kind of data versus having file cabinets and gigantic rooms dedicated to paper storage. So it kind of saves on that, and it kind of saves on paper, and makes it sort of a more green environment for you. But the healthcare field is changing, and that's just one aspect. And the second aspect is basically people are going to have to transform healthcare to give the tools able for consumers to access this data, for other doctors and other hospitals and other medical facilities to have centralized kind of data storage ability for consumers and clinicians. But future healthcare is this. It's there's the patients or the consumers, and then there's the clinicians, right? Mm-hmm. Usually, patients go to the office, they have a set-up appointment, they have a meeting, right? They discuss it for about 10-15 minutes, what's bothering you, how are you feeling, get a checkup, get blood work, results, tests, what have you. They do it outside of the hospital, right? Yes. The doctor himself gets all the results, comes back to him. Yes. They are responsible for communicating with the patient. Their secretaries are managing all the paperwork, right? And they have to let the patient know to come up with either kind of critical results, non-critical, follow here, or here, right? What it's going to be now is that there's going to be a portal where patients can actually interact and access all the kind of data, right? And so they can see all the results, what's critical, what's not, follow with who, follow with when. They can set up all themselves. So when you say the future of healthcare, you mean the accessibility of healthcare? Accessibility, right? And consumer-driven. The modernization of healthcare. Right now, this is how patients have been visiting doctors since great-great-grandfathers. This is how it's been. And what they decide to do, the government, Health and Human Services, they have special initiatives to help subsidize some of the costs to advance healthcare in this direction. So things like having electronic medical health records for medical facilities is being subsidized right And then after that stage is done, is what we call stage 2 of meaningful use. Stage 2 is helping give consumers the ability to access their care, access their medical records, so they can distribute, access, right, and review all their medical records and have information about it. So there's going to be a kind of discussion about this of how are consumers ready? Are they ready to accept the tools that we're going to give them to better manage their health and their lifestyles and the medications they take and the tests they do? Are they going to be able to become a better healthcare individual so they can reduce healthcare costs overall? And the answer is, I don't know. There's going to be certain populations that will and certain populations that won't kind of acclimate to this new style of healthcare, this consumer-driven healthcare, this modernization of healthcare. There's going to be a population that wants to live a certain way they want to live, and they want to visit the doctor when they need to visit the doctor, stay healthy, doing the old way that they know how to do. And there's going to be a new generation who's more used to technology and being more involved with their healthcare and being able to use the applications and the tools that we offer them, so they can actually make a better decision about how they treat themselves and how they take care of themselves. And we have more than ever, our consumers are more connected than ever. Smartphones, computers, applications, mobile devices, tablets, everything like this. They can manage it on the go. They don't have to be at home anymore on a computer or visit a doctor's office all the time. They can teleconference, email, text. It's just, there's so many different ways to reach the doctor and then reach the consumer that they can actually communicate outside of the office and not have to have appointments all the time. And for that, I see a brighter future for more individuals who better utilize the tools that they're given, and they can actually make the best of the modernization of healthcare that we're looking forward to doing.